So this is the continuation of gastroenteritis. Modrik's is my name. Please share the link with your colleague and ensure that you tell them to subscribe to always access these videos. So today, as we wind up with gastroenteritis, we are going to look at the management of gastroenteritis, the prevention, and the nursing diagnosis. So after saying gastroenteritis is the inflammation of the stomach and the small intestine, we saw that a number of signs and symptoms, and we saw the causative microorganism. So we are looking at how do we manage a client with gastroenteritis. We are saying gastroenteritis is an acute and self-limiting disease that does not require medication, especially if the cause is a virus. We are saying it's an acute, self-limiting disease that does not require medication. So what are we going to do? We are going to manage symptomatically. We shall look at these symptoms and see that each of them is managed. So the preferred treatment in those with mild to moderate dehydration, what are we going to do? Encourage oral fluids, plenty of them, oral hydration therapy. In case they are not drinking, pass NG tube, give them fluids. In case they are vomiting the fluids, please give an antiemetic drug like Placil or metoclopramide. Intravenous fluids can also be given. Level of consciousness should be monitored because these people can go in shock. Fluid balance chart should be instituted to monitor the input and output. Blood pressure should be monitored to know whether the blood pressure is going low or it is in normal range. So drinks, especially high in simple sugars, such as soft drinks and fruits, are not recommended in children. Why? They are going to increase this diarrhea. They have a high concentration. So instead of this child having diarrhea decrease, instead it will increase. So that's why we're not giving them these simple sugars or highly concentrated drinks like sodas. So plain water may be used if more specific or effective oral hydration therapy preparations are unavailable or not palatable. So we are going to give plain water. So as I've told you, NG tube should be passed to administer these fluids. I already talked about fluid balance chart. In case they are vomiting, metoclopramide is the drug of choice, which is an antiemetic to stop that. Then you can treat with the utolcopramide. We are saying it is useful in treating abdominal pain. Fermented milk products are similarly beneficial. Can give them yogurt or some of these products of milk. As you are treating these people, especially with gastroenteritis, which has caused diarrhea, zinc supplements is effective in both treating and preventing diarrhea among children. So we shall give oral hydration therapy, and you find you are giving also zinc supplement. In some cases, in the case of bacterial gastroenteritis, antibiotics are not usually used for gastroenteritis, although they are sometimes recommended. And I'm saying in the case of bacterial gastroenteritis, that's when you are going to give these antibiotics. So if antibiotics are to be employed, macrolides such as azithromycin are the best antibiotics to treat gastroenteritis. You can give metronidazole or tinidazole if the cause is a protozoa. They are going to work best. Then isolation of the patient to prevent cross-infection. Ensure that you practice barrier nursing. Prepare this proper disinfection and proper stool and vomiters disposal. Thank you for Listening to that, that's how can manage gastroenteritis. How can we prevent the condition? Always wash hands with soap and water before preparing and serving meals. Always wash hands with soap and water after the latrine. Always boil all drinking water and treat with chlorine. Store the water in a clean container. Eat food when it is still hot. Food eaten raw, such as fruits and vegetables, should be properly washed and, where possible, peeled before eating. Cover all foods to avoid contamination by dust, houseflies, and cockroach. In case a person dies of diarrhea, report immediately to the health authority. Kill the germ by sprinkling germ-killing solution such as jik on stool or vomitus and all the materials used by the person suffering from diarrhea. Then there is improvement of water and sanitation to reduce transmission of infection. Then last, we can talk of investigation of diarrhea outbreaks. In addition to that, we shall treat other infections like typhoid, treat malnutrition. There is immunization with the rota vaccine. Then stay off work, school, or nursery until at least 48 hours after symptoms have passed, because we say this person is still infectious. Nursing diagnosis, which is the last part, I formulated two. One, fluid volume deficit related to loss of fluids in diarrhea and vomiting, evidenced by sunken eyes and dry mucous membrane. Then also there is pain related to irritation of pain, sensitive endings of the abdomen by the effect of the microorganism, evidenced by the patient verbalizing abdominal pain. Thank you for listening, and I hope you share with this video with your colleague. God bless you.